Hello, everybody. My name is Mandy Shintani. As an occupational therapist and gerontologist, I am passionate about teaching practical, innovative strategies to improve mobility, independence, and to promote lifelong activities for our clients. It is my goal today that you will walk away with a new evidence-based tool that will revolutionize the services or classes that you provide, as well as improving outcomes for balance, posture, improve offloading, and all aspects of mobility for your clients. So as I mentioned, we have a jam session. I'm very excited. I have a different format I'm going to use today. It's mostly going to be about our amazing guest speakers. We have Tyler Eisenbacher, a physical therapist from Florida. Tyler has very kindly said he will be at the end of this webinar to answer your questions. We have John Hisamoto that he's doing the presentation along with. Just want to let you know, John Hisamoto was recognized by Physical Therapy Magazine as one of the top sport and orthopedic therapists in the United States. So very grateful to have John as well doing a session with Tyler. Then we have an excellent presentation by Natalie Grondin, from another physical therapist from Florida. I'm briefly going to talk to you about the design of the activator poles, how you can get them for professional and wholesale pricing as well for your clinic, your classes. Then we have a interview with Hillary Jebsen on spinal conditions, but mostly do with post-surgical spinal stenosis. Hillary is a very well-recognized therapist in Vancouver and is based now in Seattle. And then finally, we're going to talk about how can you access our internationally renowned activator training programs. And finally, we will do a Q&A with and have Tyler with us as well. Okay, so just a quick background. The concept of using walking poles was introduced to me by my Swedish neighbor. I think we can all agree the Scandinavians represent one of the healthiest populations on the planet, and I wanted to find out what they did. And she said, my neighbor said that people primarily walk to maintain their health and fitness, but they also use walking poles. When I looked at the research, this is 18 years ago, what I found is that this is very evidence-based. There are 370 independent peer-reviewed studies on PubMed, goes every month. There's so much interest in this practice worldwide. And what really struck me is that this achieves our key goals for orthopedic rehab. For, when you lean on the poles on the ledge, if you can look in the video here, I'm going to show you the ledge here. When you lean on that ledge, you offload weight off your hips and knees onto the poles. You've got 4 points of contact, improves balance, confidence, forces you into an upright posture, normalizes all aspects of your walking pattern, which you'll see a lot in our videos today. Because it's a full body workout, it's going to help your client to maintain or lose weight before their operation for pre and post hip and knee surgery, which can be key to the post-surgical outcomes. And it's a great tool that you can introduce in your clinic and use as a lifelong tool for your client to be active. So basically what I did was I took that research and looked at how do you develop a pole that has a design that has some features that make it safer, comfortable, and more effective for rehabilitation, particularly when we're talking about using it instead of other devices such as canes, and to reduce the use of walkers. And I'm very pleased to say we actually have 19 independent studies that are presently being done on our activator poles. A couple of those to do with fall prevention, posture, walking tolerance, and it's really about that ergonomic handle that we decide with the ledge, and as well as the locking system to do a higher weight-bearing capacity. Okay, so what we found when we did the development And what this webinar is about today is really the discussion about how it could be an effective alternative to canes or to delay or reduce the use of walkers to provide a more functional gait pattern. This absolutely should be done under the direction of a rehab professional. So in terms of the research, I'm briefly going to go over that. As I mentioned, there's 270. I've got here 240. That's just because the research is constantly increasing. Every month I go on there, I'm seeing a higher number. I just want to mention the research that we've got is being on the activator is international. One study in particular I want to mention with the Royal National Orthopedic Hospital in UK. That's considered to be their gold standard hospital for orthopedic conditions. And there's a study there on spinal surgery using the activator poles. But here's two studies, particularly in relationship to orthopedics, more recent. So this is a study done in Israel on low back pain. And what they found is that Nordic walking reduced the severity of low back pain, hip and knee pain while walking and increased the distance walked in 91% of the subjects. How many tools do we use where we are going to see that kind of effect in 91% of the subjects as they found here in this research study? And here's another fascinating study that came from Denmark. So this is a randomized control study. They compared Nordic walking with both home-based exercises and strength training. And what they found is improvements in functional performance were greater with Nordic walking than those two other treatment points at all follow-up points as well. So two just remarkable studies. And now, my apologies, I'm just going to start you off with the presentation with Tyler Eisenbacher and John Hisamoto.
My name is Tyler Eisenbacher. I'm a physical therapist in Tampa, Florida, and in conjunction with John Hisamoto, we are here to present to you today a new age of functional mobility utilizing the equipment and techniques utilized by urban poling. I would like to start off today's presentation by taking a look at a couple of videos. If you look at the video on the left, this is a family friend's mother who was having trouble with her walking and her balance. They asked me to see if I could come over and if there was anything that we could do to help her. As we are watching her walking, there are obviously some aspects that we could address. That right trunk lean, decreased stride length, decreased foot clearance, Trendelenburg gait, the list goes on and on. So what I did was I went out to my car and I grabbed a couple of Urban Pole's activator poles. And that's where we go to the video on the right. If we look at the video on the right, I didn't even size the poles necessarily to the patient. I just put them in her hands and I asked her to walk. And what we're seeing in the video on the right is we ask ourselves, is she safer? Yes, she is. Is she more upright? Does she not have that right trunk lean? Yes, she does. Does she have better stride length? Absolutely. Does she have better foot clearance? Yes. And so as we go through these different questions, we can see that we are addressing all of those impairments that we saw in that first video. And if we stop these videos here and we look at her facial expression, look at that facial expression in the video on the left. She is fearful. We look at the video on the right, she is more upright, she is more confident. And that is exactly what we are looking for through this presentation, is to try and increase people's functional mobility and to increase their confidence to be able to go out into the community and to perform the activities that they would like. This is that same patient that we just saw 1 year later, and she has changed from a double pulling technique, and she has now switched to a reciprocal activator technique. And we see her, she has been able to go walking every single day. She has increased her walking distance up to 1 mile. And as we see, those gait abnormalities that we had addressed earlier, she's still upright, arms are at a nice 90 degrees, her walking velocity has improved, stride length has improved, foot clearance has improved. So all of those aspects that we were looking to address have continued to be addressed, and she is able to move much more fluidly and, more importantly, safely. And as we look at that video on the right, when she's coming back in from her walk, she's looking a little bit slimmer. She has been able to be more active. It is overall impacting her health in a positive direction. And look at that huge smile she's coming in from that walk. This is something that she now enjoys every single day, being able to get out in this beautiful Tampa sunshine and to enjoy the outdoors. And that is what we are looking for. Utilizing Urban Polling's equipment and techniques is to be able to increase that functional mobility and, more importantly, increase the functional independence of every single patient in a safe manner. The question becomes, how can we utilize these techniques? We are looking to increase the functional mobility and the functional independence of all of these patients. The best way that you can do that is to initially identify the weak link. What we mean by the weak link is we are looking at what is that primary impairment that we can start with to focus on to develop a plan of care for that individual patient. Whether that weak link be decreased muscular strength, endurance, imbalance, maybe it's compensatory patterns that they have developed over years. Finding that weak link first will allow you to be specific with your treatment strategies in order to further progress that patient. Utilizing Urban Polling, we can use those polls for therapeutic exercise, home exercise programs, teaching patients the proper technique in order to address their compensatory patterns. We can use it as a balance assessment, again, to identify what is that weak link for each individual patient in order to be able to further progress them, to decrease their fall risk, improve that functional independence, their mobility, and therefore improving their quality of life. It's the ability to be able to empower the patient to not only do the things that are necessary for their daily life, but also those things beyond, that they are able to go out and do the things that they enjoy and to be able to perform those activities safely. And that's what we are going to be taking a look at today. We always have the question of what patients would benefit from the use of activator poles. And we can say that the possibilities are really endless. If we look at it from an orthopedic standpoint, we can see total joint replacements, or from a sports and athletic population, ACL reconstructions immediately post-op, meniscus repairs once they're weight-bearing, are areas that we would be able to benefit from using these activator poles. In conjunction with that, from a neurological standpoint, we could use them for gait and balance patients, Parkinson's, generalized weakness or deconditioning, especially in the elderly population. The ability for us to use these activator poles is up to the therapist's discretion, and it can be utilized in a myriad of different ways in order to be beneficial for all of the patients that we see on a daily basis. Before we take a closer look at those 4 different age groups, it begs to question, what are the benefits of polling? So what we did is we looked at a systematic review looking at the health benefits of Nordic walking with poles versus brisk walking/jogging without poles. In that systematic review, there were 16 randomized control trials with a total of 1,062 patients reviewed. So we're looking at a fairly large subset of patients. The results of that systematic review were that Nordic walking exerts beneficial effects on resting heart rate, blood pressure, exercise capacity, maximal oxygen consumption, and quality of life in patients with various diseases, and can thus be recommended to a wide range of people as both primary and secondary prevention. So what this tells us is that Nordic walking is beneficial from not only a cardiovascular standpoint, from a musculoskeletal standpoint, but also from a quality of life standpoint as well for a wide range of patients. And it also allows us to look at when patients are aging, they might not necessarily be able to go out for that long walk or that long jog as they get older. And so what this allows them to do is to be able to gain those health benefits as if they were walking or jogging while utilizing those urban polling equipment and techniques to not only increase their functional independence, but to also be safe as well. And again, that is going to be our focus today, is being able to increase patients' functional independence, functional strength, and their overall safety. People will also ask if there are any contraindications to utilizing the activator poles with patients. And that truly is up to the discretion of the physical therapist as it pertains to each of their individual patients. Each patient is going to present with various conditions or combinations of conditions that can affect their ability to utilize the activator poles. So if we look at a patient that's a high fall risk and they have significant muscular weakness and imbalance, it would benefit them to utilize a rolling walker or a rollator when compared to the activator poles until they are deemed fit enough by their therapist in order to do so. Same thing with a patient who lacks a motor control to independently move the two poles simultaneously. If they struggle with the coordination of the poles utilizing the double poling technique or the activator technique, as well as other conditions that might affect their upper or lower extremities, such as a stroke, cerebral palsy, etc. So each of these individual patients would have to be assessed by a therapist, and based on that therapist assessment, would determine if this patient is a candidate to utilize activator poles or not.
One of our best functional movements. I always like to end programs talking about research because I think that evidence-based rehab plays a very important role in what we're doing, and that we're able to utilize this information in our rehabilitation plans and programs to make a lasting effect. And so this one came across my desk and I found it to be really important, especially when I talked about that first patient. It's called Fear of Movement, Past, Present, and the Future for Rehabilitation and Health. It was in physical therapy in 2022. And it basically stated that fear of movement is a barrier for recovery and health in patients with musculoskeletal pain. And that persistent fear and avoidance beyond the normal healing process has the potential to lead to functional disability and chronic pain. And that's exactly what I saw with that first patient. Persistent fear and avoidance, way beyond their normal healing process, really led to functional disability and chronic pain. It really says that the next decade of fear movement research should focus on how to better explain the role of physical activity and exercise. And until now, the strong focus has been on the left side or the negative side of the model, but more research is needed on the right side, or how to confront this fear and program. And I think that my patient did it very well by utilizing her poles in the daily exercise programs of walking to be able to overcome a lot of that fear and lead to functional ability. And since fear of motion and movement is indeed a barrier to physical activity and health, we need to encourage people with chronic pain to be physically active despite their pain. You know, it's one that I've struggled with for a long time. And I often tell a lot of my patients that I understand that you have discomfort, and we are going to do some things to help with your discomfort. We're going to use ice and heat and compression and taping and other techniques that we all have in our wheelhouse. But despite that discomfort, we still need to engage in an exercise program that's going to make you better. Because once we get stronger, that pain is actually going to be improved and you're going to function at a much higher level. And those who do that activity go on to function really well, and those who don't have a downward spiral, and we see that they have continued dysfunction and problems. So my question really comes back to you is, what's the better choice for your patients? Is it functional disability, where they're scared of leaving their house and performing activities such as going just to the grocery store? Or is it functional ability, the ability to get out to be able to perform the activities they want to while actually enjoying themselves in doing so. I'll always take functional ability, and interesting enough, a simple addition of utilizing poles in our activity basis made all the difference in the world for this patient.
I wanted to thank everybody for tuning into this presentation today. And if you had any questions regarding any of the information that we went over, please feel free to contact myself, Tyler at advancedrehab.us, or John at proactivephysicaltherapy.com, and we would be more than happy to address any questions based on anything that we touched upon during today's presentation. We do have a citation page at the end of this presentation regarding any of those studies that we utilized during the presentation, so if you'd like to take a look at that, please let us know. Otherwise, thank you for your time, and have a great rest of the day.
Wow, you can see why John and Tyler are really sought out as international speakers. Thank you so much for such a powerful presentation, not only looking at the outcomes in terms of gait, but just really addressing, what is important to our clients in terms of fear and improving their confidence, as well as, that conversion of using the poles for rehab. And then you can see, as that lady was doing it, as a lifelong tool. Okay, so we do have another excellent presentation as well. This is by Natalie Grondin from Florida as well.
Thank you kindly, Mandy. I'm so happy that I was invited to participate in this programming. My name is Natalie Grondin. I'm a physical therapist at Lee Health Rehab Services in Fort Myers, Florida. This year is very special to me. I'm celebrating 30 years of being a physiotherapist, as we are called in Canada. I was trained at University of Ottawa and graduated in 1992. Eventually moved to Southwest Florida and found my way to Lee Health in Fort Myers, Florida. I've been with Lee Health since 2001. Currently, I do not have an active patient schedule. I'm the Rehab Services Program Coordinator. I lead two teams, the Balance and Vestibular team and the Parkinson's Rehab teams. I have the pleasure of working with coworkers, teaching them about balance and vestibular rehabilitation throughout the system, including acute care, home health. We have therapists in the ER now, and of course, especially outpatient. We have 12 outpatient locations. I also have the privilege of working closely with our community. I am involved in outreach activities such as screenings, presentations, health fairs, anything that has to do with promoting our services and working closely with our community partners. I was asked to participate, and I thought, well, that would be interesting because I don't really have active patients, but I suggested that maybe I talk a little bit about some unsolicited neighborly advice I gave, and Mandy was interested in hearing my story. This is how it started. He lives about 4 houses down from where I am in Southwest Florida, and one day I was going around the cul-de-sac and saw him walk with a walker, and I thought, why are you with a walker and why are you walking like that? So that's when the conversation started, and found out that the next day he was going to see his doctor and perhaps get progressed to using a cane, from the walker to the cane. I wanted to give you a little bit of information about Pastor David. About Pastor David, he's age 56, has had hip problems for about a year. Daily pain was getting more intense, and he was showing me some of the movement limitations he had and the compensations he had to make in order to pick things up off the floor. He recalled a previous right adductor injury while he was playing tennis about 15 years prior to this. This led to osteoarthritis in his right hip, and he underwent a total hip replacement, a posterior approach, on April 17, 2022. He followed the partial weight-bearing precautions for about 3 weeks, and after that, his doctor, his surgeon, suggested he could do weight bearing as tolerated. Currently works full time and does CT stands approximately 50% of the time. So we had some interesting conversations about movement and learning how to walk again. And he had mentioned something about practice makes perfect. And I've heard that before. Often, I think most of us agree with that. But I wanted to add a little something extra to this old cliche of practice makes perfect. And that's when the thought of suggesting something different than the progression to the cane came in to mind. Activator poles. I reminded Pastor David that really perfect practice makes perfect. And the activator poles, in my opinion, allow for the closest aid in making sure that we get these important postural and movement strategies correct right from the beginning. I have a few videos for you. I took some videos of Pastor David. Of course, it was all done in the same day, but he remembered how he walked in the beginning. Please keep in mind there's no sound in the following videos, and I'll just let you watch so you can interpret for yourself how his walking pattern is.
So hopefully what we are seeing there is the Pastor Dave is looking down. He's got a bit of stoop posture. There is zero arm swing, and a lot of pressure is happening through that wrist in a hyperextended position. Challenge with the walker as well too is that it does limit your stride length. You are you've got the barrier of the walker in front of you to increasing that stride length as well, and you can see the speed as well. So now we're going to see Pastor Dave with the tripod cane, and I'll just let you observe for a few minutes. So some of the issues you can see here with the cane as well, you are leaning to one side, causing some imbalances in your gait pattern. There's different arm swing symmetrically that you're using. You're pressing down on that cane in a hyperextended position as well. Places the great amount of stress again on that wrist joint. See Pastor Dave as well is looking down as well. So hopefully right away, I hope you can see that there is a symmetrical fluid gait pattern that is happening there. So really helping to normalize that walking pattern. Pastor Dave's still looking down, but not as much. He is more upright. His wrists, by using that ledge, the whole idea is to maintain that wrist in a neutral position and therefore not straining the wrist, which often a lot of older adults do have issues with. Actually, Pastor Dave could probably have that pole just a little bit higher, and that would prevent him from any kind of curvature on that wrist joint. But otherwise, great functional pattern. You see now he's got an increased speed now with a bit more practice. That's one of the outcomes we see a lot is gait speed. And now he's got his head more upright. Nice posture there, Pastor Dave. Next, what
So
we've
I would
got is
like
an
to
interview.
just remind everyone that I did not really instruct Pastor David in the correct technique. I think he did a great job teaching himself. So I'm sure Mandy may have a few suggestions to make watching these videos. He was very, very happy with the activator poles. I loaned him for a little bit. And this is a brief interview with some interesting answers from Pastor David.
Hello, Mr. Acton. Can you tell us briefly about your hip and why you had surgery?
Sure. Many years ago, I had an injury to my leg. I never got it taken care of, and when I went into the doctor this time, he said it had turned to arthritis in my right hip, and the only solution was to get a transplant. So we went through that.
And how did you feel after your surgery?
Right afterwards was pretty painful, probably 2, even 3 weeks of extreme pain. Needed all the pain medications they allowed, but then it did get better after that.
And what was the difference between using the walker and the poles?
The walker worked fine as far as getting me around, but I found myself hunched over quite a bit, and caused pain to my hands, and that feeling of always looking down and being very unsure. The poles allowed me to look up and walk straight and have my normal gait, at least as normal as it could have been after the surgery.
So the poles really were a lifesaver. Can you share with us why?
Yeah, for me, in my work, I was able to go back to work fairly quickly, even right after the surgery. And by having the poles, I could carry on a normal conversation. I could look people in the eye. I could get around the office like I needed to, and super convenient. They could be folded up, packed away very quickly. For me, they were exactly what I needed.
So would you feel comfortable suggesting them to other people with a hip condition?
I would. I felt pretty comfortable and pretty, healthy, able to use them well. If someone felt like they needed the extra support of crutches or even a walker, that's probably the better way to go. But for me, or for anyone in the same situation, wanting to be, up and down, straight up and down, wanting to get back to work as quickly as possible, I would highly recommend them.
And has your doctor seen the difference?
Yeah, he said he was very surprised how quickly my return to work went, how quickly I was able to move and have full motion, be pain-free, to be able to walk straight up and down. He was very pleased. Within 3 months, he had taken me off all restrictions whatsoever, and I'm back to 100%.
Thank you for your information.
Thank you.
So in closing, I would like to share a few ideas I have about the activator poles. Many, many benefits. I'm just naming a few that really come to mind. I feel that with the activator poles, it facilitates early learning of proper postural alignment. We also know that developing these bad habits, they're hard to get rid of, and so it's much better to focus on establishing good postural and movement habits right from the beginning. To me, it's really a catalyst for normalization of gait pattern. It's the closest thing if the person has adequate coordination. It does take a little bit of coordination, but that learning curve with the right help can bring about some wonderful outcomes. I wish to thank Mandy and Urban Polling for this opportunity. I hope that you keep up the exceptional work, and that I will keep providing help with our community in promoting the use of the activator poles with our therapists and with the people I encounter. So have a wonderful day and enjoy the rest of your day.
Well, thank you so much to Natalie. I thought those were great videos showing the walking patterns with other devices, and of course the comments from Pastor Dave. So thank you so much to Natalie. So I'm just briefly going to talk to you about, a lot of people ask us, how did we change the design for rehabilitation and how does that differ from other poles? So just very quickly, as I mentioned earlier, the whole idea is that we wanted it to be ergonomic. So versus your hand being in a strap with your hand is in a hyperextended position, we wanted to keep that wrist in a neutral position. That is to help to prevent strain and repetitive strain injuries through your wrist, particularly for people who have arthritis. The whole idea is, if you can see me through the video here, is that you actually want your client to have a loose grip and pushing down onto this ledge. That's going to provide the offloading. That's going to help to push them into an upright posture. Every time they press down it, they get core strengthening. And of course, they've got the 4 points of balance. It is FDA registered, and we're very excited. It also was certified with the Arthritis Foundation last year for their ease of use program due to that ergonomic handle. So a lot of people, the most common question we get is, besides, having the wrist in that neutral position, why did we develop it without a strap? And really, there is a study that was done by Dr. Knobloch in Germany. And what he found is that overall Nordic walking is safe for the general public. However, most injuries occur during a fall or when the pole gets cut and the user is still attached to the pole with the strap. So the highest rate of injury is the ski or thumb injury that you can see here. And that is one of the main reasons we developed it with that ledge, because so many of our clients are at a higher risk for falls. We also developed it with this button lock system. Maybe you can see in the video here. That button lock system allows for weight-bearing capacity of about 200 pounds per pole. We are still saying that your client should be at a maximum of 250 pounds with a basic activator pole. We have an activator 2 pole that can hold people up to 320 pounds. But the whole idea is that if your client really needs to put weight onto that pole, as a therapist or instructor, that's not going to fail or move around because it's got a button lock. And then finally, we did put on some large bell-shaped tips on it. A true Nordic walking pole comes with a boot-shaped tip. For rehab, we changed that to a bell-shaped tip, so that provides greater stability. But just let you know, the tips are interchangeable. So as you saw earlier, John started off with his client first. She was using the bell-shaped tip. They moved her later on as a lifelong activity to the boot-shaped tip, so she can use it more as a fitness tool, using more of the Nordic walking technique there. You can also tape off that bell-shaped tip, and there is a carbide steel tip underneath. So usually we do recommend the activator technique. You saw John was using earlier with the double polling technique as well. And those are some things that you can learn as well in our training programs. So very quickly, just want to mention, if your client needs them, the poles are available through our distributors, as well as on our website, urbanpolling.com or Amazon. However, if you are an instructor or therapist, we do have professional or wholesale pricing. In the US, you can just contact Diana Rodrigo. If you don't mind putting Diana's email address in the chat button, or you can call our toll-free number and get her extension, I believe it's extension number 3. If you're based here in Canada, you can just contact us directly at orders@urbanpolling.com, or a toll-free number. Just speak directly to our orders desk at extension 1. Diana, if you're in the United States, we'll put you in charge of or contact with one of our US distributors. Here's some of them. Maybe you're in contact with them already, and you can just contact them directly. Okay, so I'm going to move on now to a talk with Hillary Jebsen. She's going to talk about spinal conditions. So welcome, Hillary, and thank you so much for joining us.
It's a pleasure.
Hillary, do you want to tell us a little bit about your work experience at VGH?
I've worked with the acute spinal cord program actually since 1987, and more recently at Vancouver General Hospital. I was a senior therapist for many years, and then also as a regular grade 1 therapist.
Great. And what kind of conditions did you guys treat?
We saw acute traumatic spinal cord injuries, but then there was also an elective spine population from chronic conditions like lumbar stenosis, scoliosis, kyphosis.
Okay, so a wide range then. Yeah. And you're one of the earliest adopters as a physical therapist using the activator poles. Do you remember approximately how long ago that was that you started with them?
I think it was about 15 years ago, and you came to the VGH and did an in-service on the poles, and it was like, well, these are great. And I immediately thought how I could integrate it to our practice, because there's a subset of our patients that had lumbar fusions that came in, we mobilized them, and tended to send them home on two-wheeled walkers. And these patients had a forward flex posture, came in for surgery to alleviate it, and then we're sending them home on a walking aid that actually reinforced that posture and didn't teach them how to stand upright and improve their gait. So when Mandy, when you showed us the poles, I started to explore the use of them on the program. And what I did with, I took several post-op patients and I assessed their gait using two-wheel walker, four-wheel walker, auxiliary crutches, forearm crutches and canes, and the poles. And I'd take a video from the front and then also from the side, and then I'd sit down with the patient to evaluate what their gait looked like, their posture, their balance, whether they were symmetrical, and also how they felt, what their pain level was like. Did they feel secure on the poles? And nearly everyone preferred the poles to any gait aid. And for quite a few, it really helped their extensions through their hips, their toe off, and their step length, and eventually heel strike, which also translated to better gait speed.
Oh, wow.
So we started using them routinely with patients, would get them mobilized then safely. Sometimes started on a two-wheel walker for confidence or pain, but quickly progressed IV pole, single pole, and then just both poles. So it was quite a huge transition for this population to now be going home on with walking poles, and some of them had two-wheel walkers as well. So I believe in multiple aids for different situations, but the poles were really integral for getting them walking, increasing their distance, getting out into the community, and ultimately not using the pole as a mobility aid, but as a fitness aid.
Yeah, that's really key, isn't it? That clients can really feel like they can use it for a lifelong activity, because they're regarding it as a fitness aid. Can I ask you, what was the response from the surgeons with this change in practice?
I did a presentation to the surgeons about why we were changing our practice and using these, and they were really supportive of it. And then when they saw the results of the patients coming back into the clinic, they were really positive and supportive about it. They felt that the patients that used the poles did much better with functional outcomes as far as gait, posture, and pain management. These were subjective outcomes because we didn't measure them, but they felt that they had a really positive benefit for the patients.
And what was the response from your patients in terms of this change as well?
Well, they didn't know
Right.
the previous experience, but and it's a collaborative thing. You work with the patients. How do they feel on them? I think psychologically it really helped them. It was positive because they didn't see it as a disability aid. They saw it as a fitness tool. And, a lot of people use them as a fitness tool. So when they're out in the community, walking in the neighborhood, they're out there working on their fitness, not working on their mobility as a person with an impairment. So it was initially that post-op patient, but we expanded it to incomplete spinal cord injuries, patients with comorbidities such as Parkinson's, arthritis, really benefited from the poles. And from the acute spine unit, the poles then were transitioned to the GF Strong, the rehab unit, which then explored using them with a lot of other populations. Anyway, they're great.
Well, thank you so much, Hilary. We really appreciate your time and your the use of the activator poles over all these years. So thanks so much for your expertise.
Thank you. It's really changed practice in a way. Take care, Mandy.
Take care. Bye-bye. Oh, well, thank you so much to Hilary, who, as I mentioned, was one of the earliest adopters, along with her surgeon, Dr. Charles Fisher. Okay, so we're almost here at the end, and then we're going to do our Q&A. So please don't hesitate to put in your questions in the chat or the Q&A section. I can see Tyler Eisenbacher is here. Thank you, Tyler, so much for joining us. So I'm just going to end off with just letting you know, we do have an activator course. It is 4 hours. Actually, Tyler and John Hisamoto have developed one specifically for ortho rehab, which we'd like to give you some more information about in the follow-up email. The course is generally, the general course, so is available online, live virtual. It's really about learning how to confidently and effectively implement the activator poles and urban poles into your practice for gait retraining, as well as we'll show you a bunch of standing exercises that you can do in your clinic and to carry on the home-based programs. The course is CCU approved with, I believe it's actually 47 physical therapy state boards now, as well as the Functional Aging Institute, the American College of Sports Medicine. And again, Rodrigo, if you don't mind putting in the chat box, Diana's email, if people have specific questions, but we'll put some more information in that follow-up email as well. Just want to let you know, while it is new in the United States, a fairly new practice, it is recognized by the World Confederation for Physical Therapy, both for strength and for balance. And finally, in summary, we just talked about some of our key goals, how those can be achieved for ortho rehab. We talked about offloading, balance, confidence. Tyler and John talked a lot about reducing that fear of falling, posture, normalizing your gait pattern, weight management tool, something that you can use in your clinic, to the community as a lifelong tool for gait retraining, as well as for a bunch of standing exercises. Okay. So I'm very proud that I have actually allowed for 10 minutes for questions. I went over last time by quite a bit of time, but if you have any questions at all, please put them in your chat button or the Q&A. And I am just going to go in the chat section now, and I'm going to try to direct some of your clinical questions to Tyler. So let me just see what we've got here. Okay. Okay, just a lot of people saying thank you. Excellent presentation. Oh, thank you so much. Excellent presentation. Someone's got here that would love it if we just addressed fear of falling on a separate topic. Absolutely. Someone's got here too. Please consider how you can involve fitness professionals. Absolutely. You know, I think fitness professionals can play a very active role. Sometimes we do have physiotherapists show the person how to use the poles in the clinic, but then we'll refer them out to people to join classes or to physical therapists. And then, of course, absolutely, particularly when the people are past their rehab period, a lot of people want to continue using the poles, and we'll definitely reach out to fitness instructors as well. Okay, someone's got here, what makes the urban poles different from other Nordic poles? So just really quickly, the Nordic, few things that are different. All Nordic poles generally come with a strap. So not sure if you saw earlier that study that highest rate of injury related to poles is the strap. So ours is strapless. We've got the ledge instead that you can use instead of a strap that keeps that wrist in an ergonomic position, as well as our locking system. It is a button lock system that will not fail. It won't slide. You know, there are other good poles around, but I always cringe when I hear people are going to use poles from Costco or for Walmart, particularly if people are using this instead of other devices, right? You want to use something that is safe, that is reliable. So that's why we've got a button lock system there as well. And that just has a different bell-shaped tip to it. Although you can put a boot-shaped tip on, that's in our urban poles, comes with a boot-shaped tip and a turning lock system. Okay. What is the greatest barrier to getting poles to patients? Tyler, I'm going to let you answer that. What do you think is the biggest barrier to getting poles to patients?
I think the biggest barrier for patients is poles are kind of a newer in the realm as far as an adaptive equipment for patients to use. Most people are used to seeing in the community rolling walkers, a rollator, a single point cane, even a quad cane, something along those lines. And so when they see the urban poles, it's a different look to them, and it offers the patient different abilities of what can they do with the poles. And from a safety and stability standpoint, just because it's newer to them, they're very unsure, and it's like we talked about, that mental barrier of the fear of falling. They might not look as stable to them just seeing that, as seeing somebody else using them. But then as soon as they get them in their hands and they're able to utilize the poles and get a feel for, how we want them to use those poles correctly, and they get taught on the techniques that we're looking for, they tend to open up and become a lot more receptive to being able to use those poles and see the benefits of, what are the possibilities that we could use. Not only to have them in a rehab setting inside of the clinic, but also transitioning that, like Mandy was talking about, to those fitness professionals or to them outside in their own personal lives, to be able to give them the safety and stability that they're looking for to keep them safe, and more importantly, keep them active and moving.
Oh, thanks, Tyler, for that excellent answer. Tyler, do you find too, like when they're using a walker, of course, that transition is going to be, quite a bit slower than, moving them from a cane. Is experience as well?
Yeah, the transition from the walker to the poles does take a little bit of time and a little bit of an adjustment for the patient, just because you're going from one solid object to now two independent objects that we can move at the same time. But from a motor pattern standpoint, it's a little bit different. And sometimes it takes, 1 or 2 sessions to really get that patient comfortable with using that double polling technique, and then, moving to that reciprocal gait pattern. And then, ultimately that Nordic walking technique of being able to get a little bit more arm drive as they're walking. So working through that progression with patients can be slightly challenging off the start, moving from that walker to the poles. But again, once they can kind of build that motor pattern and become more confident with their use of the poles, you definitely see them start taking off. And, that's when they really get their feet underneath them, so to speak, where they can really start becoming a lot more active, not only from, proper gait mechanics, but also increasing gait speed and, being able to become more functional, which is ultimately what our goal is.
Yeah, excellent explanation about that transition, Tyler. So thank you so much. They've got, Taylor wants to know, is there any research on spinal stenosis specifically? I'd have to say no, not that I have seen. I can take another look because new research is always coming up. Unfortunately, at VGH, they actually did do, they attempted to do a study, but they couldn't get a control group because everybody at their clinic actually wanted to go home using the pole. So they actually did a lot of collecting data, etc., but in the end couldn't find anyone to do a control group. But overall, I think they found that, as Hillary mentioned, there was quite a positive outcome. There has been a study done at the Royal Orthopaedic Hospital in the UK on our activator poles, but that's just generally with spinal surgery. A lot of those are spinal stenosis, and they found that there was improved posture with using the poles. But spinal stenosis specifically, I'd have to, I haven't seen that yet. It says individuals cannot purchase a pair of poles in Canada. Oh no, absolutely they can. Sorry, we just have a lot of people who are here on the US, but absolutely, we are a Canadian company. We've been around for 18 years. So our website, urbanpoling.com. Rodrigo, if you don't mind putting that in our website that people can order off our website, urbanpoling.com. We'll put that in the chat button, as well as through Amazon, through lots of our retailers, through Find a Retailer. Wellwise is one of them. But my apologies, I think we're just mentioning a lot of the US because we've got a lot of, this is a new tool for a lot of Americans. Post-spinal surgery, yeah. Decompression, lumpectomy, dystectomy. I'm sorry, not saying that right, but absolutely. Tyler, if you guys use it for any of these spinal surgery conditions like decompression that are being mentioned?
We have had a couple of patients that we used. Again, it's that progression, like we talked about. So as they, are transitioning from, a rolling walker to the poles, that's where, again, it's up to the physical therapist's discretion as to where they are in their therapy and are they ready to take that step to make the transition. But once they do take the transition, again, like you talked about, working on good gait mechanics, that upright posture, being able to offload by being able to take a little bit of weight through the arms, through the poles, using that double pulling technique, worked great with those patients. They seemed to respond very, very well. So as far as using them post-operatively, those patients did benefit from it. As long as you deem them to be safe to take that step off of whatever assistive device they're using to safely transition to the poles. But once they did, they were able to, kind of take to them and gain that functionality and also still be able to maintain that good upright posture and, take some of that pressure off of those surgical sites to be able to continue the healing process, but also build back those motor patterns, which are very, very vital in those kind of early to mid stages following surgery.
Yeah, absolutely. It's really, dependent on your assessment, as you guys had mentioned earlier. So thank you so much, Tyler. And absolutely, spinal stenosis, sorry, Hillary Jebsen was only talking about spinal stenosis in her talk. So if you missed that last part about Hillary, you'll get it in the recording, but she was primarily talking about, I shouldn't say only, but primarily talking about spinal stenosis. Okay. That's true. Yeah, someone's got here that says one of the barriers to use them is sadly people are mistakenly viewing them something only used by seniors. And yeah, I think it's really important that we talk about using the poles for things like hiking. I use them for snowshoeing, winter walking. I think if we present them as a device that has been used a lot for fitness and for hiking, I think that will help to alleviate that myth that it is only for seniors. So it might help to present it more as a fitness tool rather than that has the rehab benefits, rather than talking about it just being a rehab device. Does it improve pain for those who have sciatica? What I have found is it's very individual. It absolutely can do some offloading off the back, but it is a repetitive movement. You got to do it gradually. You got to do it slowly. I find one of the most common errors is that people get really excited. They go too hard, too long initially. So that is one comment that I would say, that slow and steady always seems to wins the race. Someone's got here, Deb. In Vancouver, they're sending post-operative patients home with poles in 1 to 3 days. So excellent. Okay. It says here, we've got one here doing the question. It says, I have difficulty using the poles because they ask for my attention. I'm 67 years old and I have Parkinson's. You know what? Absolutely. There is, particularly if you have some challenges with your mobility or coordination, it does take time. Absolutely. I think, sometimes people watch this webinar and get the idea that you just get the poles in your hands and there's a change. I would suggest that you do watch our recording or our webinar specifically for neuro. This one is ortho. We have one just on neuro. That is next Thursday. You can register for that for our website. That I think would be much more helpful, but absolutely slow and steady, using them gradually. It doesn't have to be an either or situation for other devices. It can be a very gradual process. Tyler, do you have any comments, further comments on that one? This fellow having difficulty using them because he's got Parkinson's.
When it comes to Parkinson's patients, I have limited experience using the poles with patients with Parkinson's. I know that it can be a challenge as far as sequencing and motor coordination, as far as initiating movements and being able to kind of begin getting them moving. They also have that festinating gait. The stride length isn't going to be where you would like it to be initially right off the bat. So kind of trying to utilize other tools as well along with the poles, whether that be tape lines on the ground to help try and give them visual cues as far as where they would be as far as stride length or where you would like them to be, as well as maybe slowly introducing the poles to them. You doing a couple of those therapeutic exercises, whether that be some sit to stands from the chair or something of that sort, just to get the poles in their hands first before actually trying to initiate gait training or something along those lines. So that way they could get a little bit more comfortable with them, and then slowly starting to initiate those gait mechanics exercises. Even if it's using the poles and just working on getting their feet in that reciprocal gait stance and then transitioning the weight from forward to backwards, just so they can get a feel of where their body is while utilizing those poles, and then kind of slowly progressing from there. Breaking it down tends to be a great way to kind of get the patient comfortable with the poles first, and then you can build upon that just to build those motor patterns in, again, a nice, safe way that hopefully is a little bit easier for the patient to kind of absorb and understand as you're going through.
Oh, Tyler, those are excellent tips. And I completely agree. Sometimes just using them while you're exercising just to get used to them and getting more familiar with how to mobilize your body with poles is a great way to stand. But I would definitely recommend to you that watching that webinar, but also, you know, working with your physical therapist. It sounds like, particularly if you're having issues, that's where, you know, using a lot of these tips that Tyler mentioned can be really effective when you work with the therapist as well. So I believe that's all the questions we have. I just want to say a huge thank you, Tyler. Your and John's presentation was excellent. It was very powerful. It was so practical. I think you guys will do a fantastic job in teaching the course as well, that we'll send some more information about. And thank you so much to everybody who has come here across the country. You know, I've been doing these presentations and teaching about the polls for 18 years, and I'm still really passionate about it. You know, especially when we get these great guest speakers like we had today. So thanks so much again to Tyler, to John, to Natalie and Hillary for their expertise as well. So you will get a follow-up email, as I mentioned, with the recording, more resources, but you can contact us anytime with questions. So thank you so much, everyone. And thank you to Rodrigo for managing the IT issues along with this. Take care, everyone. Bye-bye.
Thank you, Mandy.
Thanks so much again, Tyler.
Bye-bye.